Thank you very much, Bill. It's always a pleasure to be able to discuss surgical management of patients with drug-resistant epilepsy. And as you know, I'm a neurologist, so we're largely going to talk about patient selection for chronic intracranial EEG monitoring, the surgical strategies that can be utilized, and present some actual patients to you so you have some understanding as to how this would fit into a comprehensive pre-surgical evaluation. And once again, these are my professional and personal activities. I will point out, since I have an extra minute here, that I am the member engagement chair of the American Academy of Neurology, and I hope all of you are participating in the American Academy of Neurology. We're certainly doing a tremendous amount of advocacy for neurologists right now in Washington, D.C., some very active issues that should have your attention. So look at AAN.com. We're delighted to work with you. All of the neurologists at the Mayo Clinic belong to the American Academy of Neurology. So we know that epilepsy surgery is good. This is a large study done from the University College London. Over 600 patients, adults with epilepsy, followed for as long as 19 years. Most had anterior temporal lobectomies, but not perfect. At 10 years, about half the patients were seizure-free. They did notice a particular group that stood out as doing fairly poorly with seizure outcome, the same as other centers have showed. That is patients with MRI negative, predominantly extratemporal, and these are oftentimes extrahippocampal neocortical seizures. Dr. Van Gumpel, one of our neurosurgeons, has noticed that there is a reduction in anterior temporal lobectomies in Olmsted County, which is the home of the Mayo Clinic Rochester. There appears to be a reduction in medial temporal lobe epilepsy. In patients being considered for surgery, there is an increase in those who have extratemporal seizure disorders, MRI negative, or multifocal seizures. This has not only been observed at the Mayo Clinic in Rochester, but we participated in a multi-center study of a number of institutions, including New York University, Cleveland Clinic, and UCSF, and found that this is a trend that is nationwide. The number of operations being done in the States is relatively flat, as you heard from Dr. Warren, but the composition is different. We're seeing less patients who come in as adults with mesial temporal sclerosis, unilateral temporal lobe epilepsy. We're now seeing patients who have MRI negative, MRI multi-lobar abnormalities such as malformations, multifocal seizures. Why this trend is, we don't know, but it's not unique to any one institution. Now, how do patients with MRI negative epilepsy do